Good afternoon, Dr. Berter. Patient presents to the hospital today, a 62-year-old male with a fever that started about 2 days ago. His daughter reports he had been complaining of fatigue as well as breakthrough fever despite his around-the-clock acetaminophen administration. Patient has a history of stage 4 prostate cancer with metastases in both his spine and hip. And he had just undergone his third cycle of chemo treatment with IV docetaxel 10 days ago. After a physical exam, he was febrile with a temperature of about 30 to 8 degrees Celsius. He appeared very malnourished. His blood pressure was 80/40, which is obviously severely hypotensive. He was tachycardic with a pulse of 110, as well as his respiratory rate was elevated at 22 breaths per minute. After a blood draw, his ANC was 300, which is severely neutropenic. He had a serum creatinine of about 6 mg per deciliter with a BUN of 57 and a creatinine clearance, which was calculated to be about 12.6 milliliters per minute, indicating some sort of acute renal injury. With all the evidence considered, the patient expresses the signs and symptoms of sepsis, and I would recommend that he be initiated on Vanco 975 milligrams Q48 IV, obviously, and request troughs and between 15 and 20 mg per deciliter, and as well as for gram-negative coverage, imipenem with cilastatin, 250 mg IV Q12, removal of his Hickman port catheter for the chemo, as well as continue any and all fluid repletion and furosemide regimens. Definitely monitor his serum calcium, BP, any and all fluid output, as well as serum creatinine and BUN. Thank you.